Hi everyone, my name's Becca, and I'm going to be talking to you today about an issue in Chapter 7, Bartering for Professional Services. So, if a situation comes when a client is unable to afford therapy, a bartering arrangement can be made between the therapist and the client. Bartering, by definition, is the exchanging of goods or services in lieu of a fee. In some cultures and even small and rural communities, bartering is an acceptable, even normal practice, so it should be evaluated by the counselor in a cultural context before making a decision about bartering. Most ethical codes provide guidelines for ethical practice of bartering, so this can be very helpful for clinicians and therapists. These include the American Psychological Association, the American Counseling Association, the American Association for Marriage and Family Therapy, and the National Association of Social Workers. Just as an example, the APA Code of Ethics states that psychologists may barter only if it is not clinically contraindicated and if the resulting arrangement is not exploitative to the client. The National Association of Social Workers, the revision committee actually struggled whether or not to prohibit or merely discourage all forms of bartering because it entails potential conflicts of interest, but it's also a very acceptable practice in some communities and cultures. They ultimately decided to strongly discourage bartering because of the risks involved. However, it is not inherently unethical. So there is current research both for and against bartering. Those who are for bartering emphasize the best interests of the client and the professional character of the therapist. They don't believe it should be ruled out just because of a slight chance of a lawsuit. Higher standard of consideration of the welfare of the client is emphasized, as well as documenting the arrangement and written contracts. Documentation can avoid legal ramifications for the therapist if some legal situation happens. So the current research against bartering, they believe it's unwise to engage in bartering for services because it opens the door for misunderstanding, perceived or actual exploitation, boundary violations, and reduced clinical effectiveness. As a counselor, there are several things to consider before entering into a bartering arrangement. These include, first and foremost, evaluate your professional risk. Will this cause a negative impact on your performance as a therapist or your therapeutic relationship with a client? Determine the value of goods and services with the client. And if it is services you agree on, determine the appropriate length of time for these services. Documenting the arrangement is super important. Make sure you include the value of goods and services and the amount of time. A written agreement of the bartering arrangement between the client and counselor can also help if a legal situation happens for the therapist. Consulting with your experienced colleagues, supervisors, and professional organizations can also be a helpful tool in deciding whether or not a bartering relationship is appropriate. So, bartering is an acceptable practice in some cultures, and it can be a dignified and honorable form of payment for those who are financially poor but actually excel in other areas. Cultural context and judgment are important for therapists when considering bartering, and understanding these potential risks and benefits will prevent unethical practice. These guidelines, along with the ethics code guidelines that are laid out for therapists, will help prevent unethical bartering practice.